Homespire has been in operation since May in Salt Lake County, but we realize that there's been a lot of confusion about who we are and kind of where we fit in. Some of that's probably because of all the reorganization that's been taking place in Intermountain, but I'm not here to focus on that today. I'm actually not even here to tell you more about our services or what we provide. There are some training modules that will be going out, as well as some other material, and many of you may have already walked past the table that we have set up outside of the auditorium. I'd like to introduce, I'm going to put them on the spot for just a second. And actually, Emily and Paul, Emily Red and Paul Astle are our two liaisons. If everybody looks up, they're here on my right. But there are two liaisons, and Emily's really friendly, and Paul's pretty cute. So I encourage everybody to go meet them to learn. Thank you. I encourage everybody to go meet them to learn a little bit more about what we do. You'll see Emily and Paul out in the community as well. The few minutes that I do have today, I want to talk about our why. Why we all do what we do. Right? We're hearing a lot about population health today, about the need that we have to begin to shift our focus from primarily a reactive focus in healthcare to really focusing on proactive wellness and life management. That's pretty exciting. There are a lot of other organizations that have population health programs throughout the country, but nobody that I've seen is doing this the way that Intermountain is doing this, filling the gaps the way that they need to be filled, building a continuum and a seamless experience for the clients and the patients that we serve. Think about why each of us got into the field that we're in to begin with, right? We got into it to make a difference, to help other people, to help them succeed, to help them thrive. I want to tell you a little bit about a story about a client of ours by the name of Mary. You'll be seeing, that's the video or the movie that we're going to end on, and learning more about Mary's life. I just want to provide a little bit of background first of all. Mary's an 88-year-old widow of 18 years. She has 6 children. Her children are very involved. They come by, they visit, they help out where they can. But Mary, she loves to go to church, she loves to knit, and more than anything, she wants to be able to stay at home. Mary had a couple obstacles, I should say, to her goal. She had 2 strokes within the last year, and the last one was pretty severe. It really threw her back. She did the rehab, she went through, she was at IMG, she went through home health afterwards, but then the insurance says, and because of Medicare and what it says is, you're up to this point, you're no longer really homebound by the criteria, so we're not able to stay in the home any longer. So the family started having conversations with Mary about whether home really was a safe place for her to stay or not, and she became terrified. The family was concerned about falls, they were concerned about UTIs, and they didn't know what to do. And that's where Homespire came in. So it's because of people like Mary that I do what I do. And I know that's why many of you are doing the same thing and do what you do also. We've had many conversations. I'm going to advance here. So we've had many conversations with Raylene Gomez, with Sarah Peterson, with their managers and directors, Rebecca Cooper-Knowles, Kim Hendrickson, Rob Allen. We've been having all these conversations. The list goes on, and we look forward to visiting Gington and Maria Hillvetter also. And there's more clarity regarding Homespire's role in Intermountain's continuum than there ever has been before. We're aligned in our vision, as well as our thinking, and we're excited about that. We have this need for a continuum. We need to create that seamless experience for our clients and their families, and we realize that Homespire is just one component of that. We've all seen the gaps that exist in the care that we provide, right? We've seen the needs to extend the care beyond the traditional boundaries of what care really is, to address those social determinants of health. We've seen the need to help particularly our elderly loved ones to live with passion, right, and purpose. We think that we're succeeding just by keeping people out of the hospital, and that's huge. That's huge. That's extremely important. But at what expense sometimes? Are we keeping them out of the hospital, and that's a win, but are they spending the rest of the day in front of the television when they'd rather be doing something else? Or on narcotics and sleeping half of the day away? Right, we want to address the purpose and passion as well, with the support and guidance that they need as well to keep off of the roller coaster of the healthcare crisis. This is a visual that as we come out and we meet with your different groups, you'll see a lot. We talk about this roller coaster, right, where somebody goes from independence and they have some type of sentinel event or crisis, or maybe a little bit more insidious. It may come on slowly, but they start this roller coaster, and that crisis for them is they lose independence. We want to work here with you, side by side, to do our part, to be able to extend Intermountain's care management even further into the home, to be able to help people like Mary, like our neighbors and our loved ones, to be able to stay at home longer. Services are private pay for now. So we realize that that introduces an element of challenge, right? That a certain scope of people we can't help, at least at this point. However, we're already working with Nick Bassett, as well as early conversations with Select Health, to be able to offer more of Homespire services to more people. Ultimately, we envision this being something that's available for everybody because it's the right thing to do. We also, you're going to hear some stories later today about how we can help clients even before they start with us. And we are actually, our commitment is to help everybody, even if they never do become a client of ours. All of us today are critical to our clients and their family's life experience, not just for their health care. So this is an opportunity, again, that we see to be able to deliver on our promise to help people live the healthiest lives possible. We want you to be able to count on us. We want to do our part to make a difference, to do it for Mary, to do it for Bob, to do it for Betty, to do it for all the people that we come in contact with every day. I'm going to end by showing you Mary's story. I'm hoping that we're queued up here. Well, I do have a clip or two, so hopefully this will go into... Actually, let's see. I don't see it here. Is that stored somewhere else? Okay. And then I'll just say a few words to end. It's a video. I don't know if it's embedded or...